Welcome back to Our Canada, Our Future. We're joined today by Dr. Kevin Bardish at the University of Washington talking about trade-offs from COVID restrictions and vaccine mandates and passports. Kevin, we were talking before about loss of public trust. I wanted to turn to concerns about vaccine hesitancy. Now, it's not new that there are some people who are skeptical about the effectiveness or the safety of all kinds of vaccines. As a result of the pandemic, of course, vaccines, specifically the COVID vaccine, are a lot more prominent now. What do you believe has happened as a result of these measures surrounding, really encouraging or in some cases arguably coercing people to get vaccines?
Yeah, I think it's backfired tremendously. I daily talk to, I'm a social scientist, so I'm always curious and talking to people, asking them their opinions. On a daily basis, I encounter people who say to me, I received all of my vaccines. I will never get a vaccine again. Hands down, right? I have not gotten my children vaccinated because I no longer trust vaccines. I no longer trust our public health authorities. This is occurring at a global level. I'm happy, doing a lot of work in Africa. I'm happy that African governments didn't mandate COVID vaccines. I think that would have been a disaster going forward on the continent. In Canada, we face this very polarizing situation where people who got vaccinated, third dose, possibly even fourth dose at this point, and they haven't been exposed to any reasoned arguments. For example, why if somebody had a prior infection, they don't need to get vaccinated, or they don't feel like they need to get vaccinated. If they haven't been exposed to that perception, right, they're living in sort of a bubble on this side. On the other side, right, there's people who very strongly believe that the vaccines are fundamentally dangerous. And I think it's very difficult in that polarized environment to have a conversation, again, going back to what I was commenting on. What are the benefits of these vaccines for specific age groups? They differ, as with any pharmaceutical product. I think if the government had, for example, in the UK right now, they are not recommending boosters to young, healthy adults under 40 years old, okay? The US government and the Canadian government are taking a very different approach. Denmark is no longer advising children and young adults to get vaccinated for COVID because everyone's had COVID already. And we know, and this is one of the major things, one of the major hiccups of this whole vaccination program, the denial of the human immune system, right? The ludicrous idea that you would get a virus and not be better equipped to meet that virus in the future. It doesn't really square with reality. In fact, it's quite interesting. Before the COVID vaccines, there was high-level discussions at the WHO and elsewhere about immunity certificates, meaning if you got COVID, you would be granted the so-called green pass, and the other people who didn't have COVID would, have to be locked in their homes, right? And then suddenly when the vaccines came around, oh, well, immune status doesn't matter anymore. And I think that singular point was one of the most decisive miscommunications of the public health establishment. It was an error of judgment, and it reflects, again, going back to my earlier comment, this notion, this very paternalistic notion, right, that the government authorities and the government scientists, and I say government scientists, not scientists, right, people who have a very particular advisory role, and there's pressure to conform to the dominant thinking of the government. So there's effectively a sort of conflict of interest or groupthink that develops in these advisory groups. That they failed in that regard. So I think that I know that there's a lot of, I'm very aware of the vast literature on why people don't take vaccines. I've worked on vaccine programs. Typically trust in vaccines is correlated to socioeconomic status. Why is that? Because people that are lower down on the socioeconomic ladder have been at the brunt end of arbitrary government policies. They've experienced difficulties in their life. They've experienced people not caring about them. For example, I have a family member who was tragically disabled from a Pfizer pharmaceutical product, not a COVID vaccine, right? They did not want to get vaccinated. Are they unreasonable? I don't think so, right? They fundamentally, Pfizer is actually as a corporation, they've paid some of the largest corporate fines for fudging pharmaceutical clinical trial data. And yet suddenly we all need to believe them. That's not how you build trust. The studies on trust show being transparent, accepting uncertainty, being honest, right? You might have less of an uptake on a vaccine in the short term, but long term, you're going to increase your uptake on vaccines because people actually believe that what the government is saying is real. And I think that just this notion that you don't have to be real with people has backfired, and it's going to continue to backfire if public health doesn't reform itself and sort of accept that it is functioning in a democracy for the citizens of the country that they're working in. So yeah.
Great points, Kevin. We're going to take a short break and be right back.